most people always envy nurses when it comes to that 4 extra days that they have for themselves. If you're a full-time, and if you're a part-time, you can choose to work just 2 days a week and you have 5 days to yourself. And if you're a per diem, that means bigger money, and that means so much time for you. If you're somebody who wants to be attached to a noble profession, I can always guarantee you that nursing is going to be that profession that you are going to be so respected in the society. Hi guys, and welcome to my channel. In today's video, I'm going to give you 10 compelling reasons why I think you should become a nurse. Stay tuned guys, as at least these 10 points. You don't want to miss this video. The very first point is going to be making a difference on the lives of patients. Look, when you come to the hospital with a medical diagnosis, most patients are very confused as to what it entails in terms of their care. Most patients feel like they are helpless, and so we nurses come in to give them that comfort, that support, which for most patients they are very, very grateful. Most patients look at it like we are lifesavers for them. Most patients are actually happy that there is someone to care after them when they very much need that care. And so the kind of impact that we have on our patients, those patients who are going to be receiving life-changing diagnoses, maybe they are told that they are terminally ill, they have cancer, or they have to, wear oxygen for the rest of their lives, or they have a blood clot and they have to be on blood thinners for the rest of their lives. We nurses come in to be able to educate them, to be able to tell them that, hey, this is not a life sentence. We give them that support, we give them the encouragement, we give them or list every resources that they're going to need in order to navigate this new journey that they'll be embarking on. And so most patients always leave the hospital feeling very, very grateful to us nurses for the sort of care that we gave to them, the information that they got from us, and most especially the comfort and the support that they gathered or they drew from us. Next thing on the list is going to be job stability. Look, I know that every day that I look at my phone, the number of text messages I get, the number of emails, the number of calls that I get for, hey, we have a new job opportunity in this place, are you available? There is so much job stability when it comes to the profession of nurses. I cannot even tell you how much nurses are being, they are being searched, how much nurses are being looked for, how much nurses are being scavenged, or how much nurses are being needed in most hospitals, doctors' offices, in most nursing homes, in just so many healthcare facilities that the nurses come in very, very vital. As much as the doctors are going to be needed to diagnose the patients of these diseases, the nurses are more vital, in my own opinion, in terms of the care for these patients. We come in to play the role of comfort and support for our patients. We come in to play the role of explaining things for the patients. We come in to be able to explain to them or let them know, hey, moving forward, these are the kind of life changes that are going to occur because of the current diagnosis that has been, given to you. Also, when we think about the old age population who are also getting older and their lifespan is even increasing, with this booming population, there's also going to be a very high need of nurses who are going to be sorted after to take care of this population. Nurses are not only needed here in the US. I can tell you that I have co-nurses, or I have other nurses that work with me who have told me they've worked out of the US, they've worked in Dubai, and there is just so many healthcare facilities or healthcare settings that I can recommend that nurses can always work there. And so I can tell you with all certainty that the nursing profession will always have a job stability. The next thing on the list is going to be the wide range of career paths that are involved in the nursing profession. If you want to go the emergency route, if you want to go oncology, if you want to go dialysis, if you want to go pediatrics, if you want to go OBGYN, you have a wide variety to choose from. And so nursing will always come as that profession wherein you have something that is going to cater to whatever your passion is. Take for example, you love to be around kids, then maybe pediatrics is good for you. If you love to be around the older population, then geriatrics is going to be for you. If you love your newborn babies, then NICU or maybe the newborns facility or unit is going to be for you. If you love the pregnant women, then OBGYN is going to be for you. If you are that person who is much more adrenaline pumping, you want to be in the psych facility, you can always go ahead and go for that specialty. Or maybe you're one of those people who love to do dialysis and you like to be around machines, machines, then the dialysis centers are always open for you. So nursing is a profession that I can guarantee you that there's going to be so many specialties. You can choose from what you love to do and the sort of patient population that you want to surround yourself and go for it. Next thing on my list is going to be the continuous learning in our profession of nursing. Let me tell you something. As years are going by, things are evolving. There are many things that have been discovered, machines. There's also better ways that have been discovered in how to care for our patients. And so the nursing profession is going to be the profession where you're continuously learning, you're continuously accumulating skills, you're continuously elevating your understanding and how to better care for your patients. I can tell you there are going to be so many CED, or there are going to be so many continuous assessments or continuous education that you will have to be taking in order to be widening your scope of learning. And so if you're someone who is not very much, wanting to learn more, who is not inquisitive, I will tell you that nursing is not that route for you. But if you're someone who loves to learn, who loves to ask questions, who loves to know why things are done certain way, nursing is going to be that career for you, where you're going to keep learning and you're going to keep learning and you're going to keep learn. The next thing on my list is going to be the global opportunities. Like I previously said, I know of so many nurses who have ventured to go to Canada, to Dubai, just because they have that nursing certificate or nursing license. Nursing is a career which is very much global. It entails caring for patients, and so the way we are going to care for patients, I think, should be standardized in every other country. If a patient is in pain, you definitely know that you want to give them pain medicine. If a patient is nauseous, you definitely know that you want to give them some nausea medication. If the patient is having difficulty sleeping, you definitely know that you want to give them some sleeping medication or something to help them sleep. If a patient is uncomfortable, you want to talk to them and have a communication with them to be able to understand what might be disturbing them or what might be preventing them from sleeping, or whatever the scenario is. I feel that nursing is universal, nursing is standard, except for some little protocols that might differ in some countries and in some hospitals or facility, but the baseline in terms of caring for a patient will always be the same. And so because of that, nursing has a very global effect when it comes to caring for patients in different countries and in different settings. And so the global opportunities that nurses have in order to work in different places where they can also experience new places, new cultures, new ethnicity, it's just a very positive aspect for most nurses out there. And so I'm going to encourage you, if you are someone who loves traveling, if you're someone who likes discovering new places and new things, nursing might just be that profession for you. The next thing on the list is going to be the sense of fulfillment. I know personally from my own experience that when a patient is in dire need of something, let's say the patient really needed pain medicine and no one has actually maybe addressed that situation, and when you address that situation, there's that sort of gratefulness that comes from the patient, and there is that sort of fulfillment that comes from you, the nurse. When a patient comes to the hospital and they are scared, like, is this life-threatening or is this something minor, like what is going on? When you take that time as a nurse to explain things to patients, you tell them that, hey, this is what we think is going on with you. Due to all the tests and x-rays that we've done, this is what is actually happening. Maybe, for example, the patient has a blood clot, and you explain to them what the blood clot can lead to, maybe a stroke, breathing difficulties. And so because we found those blood clots, we are going to be putting you on blood thinners, which is going to prevent maybe strokes and that breathing issues. And in that case, it makes the patients to be able to understand what is happening, and it makes them very grateful to you for kind of taking that tension from there. Take, for example, I had a patient who came to the hospital for a new onset AFib RVR. In the setting of AFib, heart has a tendency to produce blood clots. Now, this was totally new for the patient. The patient did not even understand what was going on. But when I took my time to explain to the patient that, hey, what you are just having right now is something new. I do understand. Never been on any blood thinner, but know that whilst you're in the hospital, we're going to be putting you on blood thinner. We are going to start you on this heparin drip. But when you are being ready to discharge at home, we are going to discharge you on maybe some Eliquis, Xarelto, or something else, just to make sure that we prevent that blood clot. If at all the patient converts from the AFib back to normal sinus rhythm, and I can tell you that the patient was so grateful. The patient came in with family members, their son, their granddaughter, and they were so grateful to me for explaining things and making them understand what the plan of action was going to be moving forward. So there's that sense of fulfillment for you, the nurse, when it comes to you making a patient understand what is going on and feeling less anxious about what to expect or what to look out for in the future. So take for example in this patient's case, she kind of knew what to expect, to know that she was going to be on blood thinner, to know that we're watching her heart rate, to know that we're watching her blood pressure, and to know that, hey, because they are now on a heparin drip, we're going to be sticking her every 6 hours just to monitor the blood clotting level so that it gets to a sweet spot whilst we are titrating the drip in the hospital. And I can tell you that this patient was so grateful for me explaining that situation to them, and that made me feel very fulfilled. The next reason why I think that you should become a nurse is that you have a variety of settings or places where you can work. You can choose to work in the hospital, you can choose to work in a doctor's office, in a surgical unit, you can choose to go work in a dialysis facility, you can choose to go work in school, you can choose to be a nurse who works for law. You sit in court cases and you say, based on my nursing judgment, I think that this is what should have been done to be able to prevent this. You can choose to go work in the rehab facility, you can choose to go work in the nursing home. So there's that diversity of place of work, and there is that autonomy for you to go ahead and say, hey, I think that based on the person that I am, I prefer to work in this kind of setting. If the hospital makes you very uncomfortable, you can always choose to go to a nursing facility or a nursing home, or you can even choose to do home health care, where you go to the patient's home and you care for them from their home or from their place of comfort. So there is that versatility of place to choose when it comes to your nursing job and where you think is going to be much more comfortable for you. The next thing on my list is going to be the opportunities of leadership. I know of a nurse tech or a CNA who was a CNA for like 5 years, and then they went to nursing school, became a registered nurse. From a registered nurse, they became a manager. From the manager, they became a director. From a director, they started climbing up the ladder, and then before you knew it, they were the ACNO. That is someone that I know. So that is the opportunity that nurses will have when it comes to leadership. Another example is going to be, I know of a CNA who became a nurse and who went further to go for the nurse practitioner route. Now they are a nurse practitioner. So when it comes to the nursing profession, there is that route or that opportunity for leadership. You can even choose to become a nurse. You go work in the ICU. From the ICU, you now move up the ladder of becoming a CRNA, which is the highest paying nursing profession in the USA. And yet there's always that opportunity for leadership, or that opportunity of growth, or that opportunity to move up the ladder, so to speak, if that is what you want. So that opportunity or that leeway or that opening for leadership is very enticing, and I want you to take advantage of the nursing profession if that is what you are looking for. Next thing on the list, don't we all like the flexible schedules that nurses have? You can either choose to be a full-time, you can choose to be a part-time, you can choose to be a per diem, you can choose to work days, you can choose to work nights, you can choose to work weekends, you can choose to work, you can choose some holidays, but most importantly, nurses work 3 days a week. 3 days a week. How nice is it for you to have 4 extra days all to yourself? And so the way most nurses take advantage of this is that some nurses would love their weekends open, and so they will choose maybe the weekdays, and so they keep their weekends open, while some nurses would prefer to work on the weekends so that they have like school days or the weekdays open for office errands or things that they have to go to that might not be open during the weekends. And so that flexibility is that one big opportunity that many people envy the nurse profession, because we have that flexibility of choosing our schedules. Now, I do understand that sometimes in some hospitals you don't have that flexibility to choose your schedule in terms of, hey, I want to work only weekends, or in terms of, hey, I want to work only weekdays. So they're going to be rotating. You're going to work this weekend and you'll be off the next weekend, but you work the other weekend. But again, there's still some flexibility in choosing how you want your own schedule to look like. And so most people always envy nurses when it comes to that 4 extra days that they have for themselves. If you're a full-time, and if you're a part-time, you can choose to work just 2 days a week and you have 5 days to yourself. And if you're a per diem, that means bigger money, and that means so much time for you. As a per diem, you probably will get to work 5 or 6 shifts per month or per 6 weeks. depending on the hospital and depending on what they define as per diem. I know some hospitals that will say per diem is 5 shifts in 6 weeks. Some will say 5 shifts in a month. Some will say 6 shifts in a month. Some will say 6 shifts in 6 weeks. So that is what entails to become a per diem. So there is that flexibility to choose whichever one you want, and more so you can choose to work days where you have your night and you can always come home and you cater to your kids' homework, you cater to your spouse, and you prepare for the next day. Or you can choose to work night shift, and then during the day or maybe the early hours of the day you can cater to taking care of your kids. So whilst they are in school, you are now sleeping, getting ready for your night shift. And so there's that flexibility to be able to switch between, or to be able to choose between day and night, and per diem, full time, part-time, and whatever pleases you, you can always go for it. So the flexibility in the schedule is amazing when it comes to the nursing profession. Do you know how many times I walk on the street and when I say I'm a registered nurse, so many people are like, registered nurse? Like, there's that sense of respect that comes to the profession of being a nurse, that so many people, I will tell you that so many people always look up to nurses and be like, can you give me more information as to how to become a registered nurse? Because I love the sort of respect you guys have in the community, in the society. I love the kind of, the way patients will also look up to you, the way family treats you very differently in the hospital and even out of the hospital. So that respect that comes with the profession of nursing, so many people find it very enticing, so many people love it. Some people even say that the nursing is a very noble profession, and that is the reason why they always go for it. So if you're somebody who wants to be attached to a noble profession, I can always guarantee you that nursing is going to be that profession that you are going to be so respected in the society. And I hope that one day you can rethink your decisions of joining our team as becoming a nurse. If you're new here, thank you so much for stopping by to my channel, and do not forget to like, share and subscribe to my channel. And from me to you, I'll see you all in my next video. Please stay safe and stay blessed. Bye guys.